16.2 million Canadians have received a first dose. Has really not much changed for them. And, you know, why keep such a tight grip on those people who have had a first vaccine?
Well, I think, first of all, you mentioned the 16.2, and I think by my last count, we're at 17 million and going up, you know, even by the hour. So I think that's great news for Canadians and Canada in general. I think in terms of what it means for people who have received that one dose, I think it's good because obviously they protected themselves. They've protected their loved ones, and also they've helped to decrease the risk of community transmission in their local region. So I think that's all important. I think the reason why people might maybe not quite fully understand why where we're being a bit, as you say, maybe restrictive, it's all because we're in many parts of the country is still going through a third wave. You know, there's lots of COVID-19 circulating, certainly in parts of Ontario. You know, the healthcare system, the ICUs are still close to the breaking point, and of course with variants also circulating, which many of them are more transmissible. Those are all things that we need to keep in mind, and we need to make sure that we don't, as you say, take our foot off the gas and let go too quickly with the public health measures as we at the same time roll out the vaccines.
Yes, and I heard, you know, Dr. Tam today talking about, well, there's the epidemiology as well. It's not the number, only the number of people that are vaccinated, but it is what the virus is doing out there. But again, I'm going to go back to those 16.2 million people because I think there is a point where people are getting discouraged. They hear you today and they think, oh my God, this looks like maybe we'll be able to have a summer, maybe not. But shouldn't you be at least encouraging outdoor gatherings, because we know by now that that is not where the big transmission is happening?
Yes, well, certainly with our summer weather, I think everyone's looking forward to it, myself included. Being outside is obviously a lot better than being inside. I think certainly from our experience over the winter months, I think that's something we can look forward to. But when you do go outside, I think it's not a sort of a one-size-fits-all message. I think when people go outdoors, especially if they've already received, let's say, one dose, and hopefully for many of us getting the second dose as well, you know, in the days, weeks, and months to come, it's also what I would say doing a personal risk assessment. So I think that if you have, let's say, underlying health conditions, if maybe you're older, you might say, hey, you know, I need to still, you know, practice, you know, personal protective measures to maybe a greater degree than maybe someone else who maybe doesn't have those same issues. The other part also I think that people also need to appreciate is that there's no vaccine that's 100% effective. And so if you said to someone, hey, even with 2 doses, you're maybe 95% protective, it's 95% effective, that sounds pretty good, you know, to you as an individual. But if you take it at a population level, what it also means is that if you took 100 people, vaccinated them, and then they were all exposed to COVID-19, actually 5 of them would actually end up getting COVID-19. So you can imagine if you extrapolate that to 1 million people getting vaccinated and being exposed, you'd have 50,000 people getting infections. And so that's why I think it's so important that people keep, you know, sort of with the personal protective measures, recognize that as more and more Canadians get vaccinated, our overall vaccine coverage and herd immunity will increase. And yes, I think we look forward to better days ahead.
Okay, well, I want to go to that herd immunity, because how did you settle on the benchmark 75% eligible Canadians to be vaccinated with 1 dose and 20% vaccinated with a second dose? Is that herd immunity?
Well, I would say that we basically took the figures based on the work of our modeling experts. I'm not a modeling expert, and there are a lot of assumptions and calculations in the models, but I think it's good because it does give us, you know, at a minimum, I would say, an aspirational goal. So by aiming towards that, but also making sure that we continue with the public health measures, then yes, as we approach that, you know, that vaccine coverage rate of, you know, 75% for at least 1 dose and 20% having received 2 doses. If you look at the situation with community transmission at that time, if all looks well, if it looks like the community transmission is at manageable levels, we're not overloading the healthcare system, then yes, certainly at a local level, we anticipate that local public health authorities would be able to start loosening the restrictive measures and have people return to more of, quote, a normal life and enjoying the activities that we all remember pre-COVID.
Okay, but you know, I want to get a conversation going that would encourage people to go get vaccinated. But your restrictions for the one-dose summer, it doesn't look much different than last year's no-dose summer. So, you know, you look at that and you go, 16 million people. If I have a one dose and, you know, the 3-4 weeks have elapsed so that the dose can take effect, why can't I sit outside with other people who have had one dose? Why can't my activities change? Why is it that the restrictions are stricter this summer than they were last summer when nobody was vaccinated?
Well, as I said before, I think compared to last summer, I think, you know, the fact is that many parts of the country are in the middle of a third wave with lots of cases gone, you know, obviously still in the community with the healthcare system being strained. What I would say, though, is that I think people hopefully can recognize that we take a collective approach, I think, here in Canada. It's sort of a community and team effort. So every single Canadian that, you know, if you get vaccinated, you're protecting yourself. And so certainly your personal risk goes down in terms of severe illness and even death, but you're also protecting the community at large by adding to that collective herd immunity. And so the more and more people that get vaccinated, and the sooner, the closer we get to our ultimate goal of trying to get back to a life as we knew it before. If people hesitate and then we don't get, I would say, the vaccine coverage rates to a higher level, then the virus will continue to find susceptible people, will continue to get infections, and we'll be in sort of this unfortunate sort of state where, you know, it'll just grumble along, and every once in a while we'll have a bad flare-up and more outbreaks. So I think it's really important to get to that high level of vaccine coverage.
But, you know, it seems that, and I don't want to say this really, but it seems that there is the overabundance of caution, you know, sort of, it works both ways. Yes, we have to stay cautious, and I understand all your arguments, and obviously they all make perfect sense. But fully vaccinated people in the States now, and you heard the president this week saying, take your mask off and show your smile. Like, he's sort of showing people that there is a light at the end of the tunnel. You know, a one dose, and we will find out what the statistics are, but people with one dose who have waited those weeks for the vaccine to take effect are not ending up in Canadian hospitals. That's what you told us. One dose would prevent that, and one dose has indeed prevented that if I look at the statistics. So why not at least tell those people, because those are the majority of Canadians, are the ones who have just gotten one dose, that yes, you can start loosening it, not going out in the community. I understand what you mean about a third wave, and there are outbreaks in certain areas, but there are certain areas where you are completely safe if you are outdoors. People can't even go golfing in Ontario, and I'm not a golfer, but it sounds restrictive, and it seems to be against any common sense. So you would understand better than most, Dr. Njoo, how some people are saying, oh, for the love of God, not this again, not some more crazy restrictions. People need to see and need to know some good news, and need to know that there will be, if you have one dose, you are protected. Therefore, there are certain things you can do, and you know that to be true.
Right. I don't disagree. What I would say, though, is that it all comes down to, I would say, a sort of doing a personal risk assessment. So first of all, with the U.S. approach, I can't really speak to that. Obviously, it's an American context, and there are different factors in play. Looking at the tough time they had, obviously, you know, over the past, several months during the winter with increasing caseloads and the hospital systems overloaded, and unfortunately quite a number of deaths. I think obviously now they're in a different place, a better place than they were before, and so that certainly needs to be taken into account. I think we're probably closer to other countries like the UK in terms of more of that population approach and a bit of, let's say, caution with respect to, you know, the use of face masks and so on. I'm also aware that even the World Health Organization, even today, also cautioned that it's not as simple and straightforward to say, yeah, if you have 2 doses, you personally, you should be able to take off your mask. You have to look at what's happening in the community, and et cetera, and so on. So to that point, though, I would say that, we'll be coming forward, I think, in the days and weeks to come with maybe additional tools and guidance for Canadians to do that personal risk assessment. For example, I could certainly see that, okay, if you have received, let's say, your 2 doses or 1 dose of vaccine, you have your tight, let's say, a family bubble, you don't really have a lot of other contacts, and you have, let's say, another household that also has been vaccinated and has their tight bubble, then potentially you two, those 2 households, if you agree and everyone's comfortable and they know that there's really been no other contact, then yes, maybe you might do a personal assessment, say, yes, we can get together, maybe, do certain things together that maybe you might not have considered doing before. Okay. But certainly I would say don't go into like large crowds or, have contact with people you don't know. I think it really does come down to a bit of a personal risk assessment and doing what you think is comfortable.
Yeah. And obviously a great dose of common sense. 75% herd immunity, is that realistic? Do you think that no country has reached that yet? Do you think it's realistic?
Well, so far from what I've seen, and I think there's been various polls out there saying that, over 80% of Canadians have either already gotten at least 1 dose of the vaccine, COVID-19 vaccine, or indicating that they wanted to go forward to get their vaccine. So I think it bodes well, and I think it's a credit to Canadians everywhere that they understand and appreciate the importance of vaccination as a very important tool to get us out of this pandemic. So yeah, I'm optimistic that it is realistic, certainly based on the intentions of what the polls indicate that Canadians want to do.
Well, we hope that happens sooner rather than later. Dr. Howard Njoo, thank you so much for taking the time, and have yourself a lovely weekend. It's going to be beautiful weather.
Same to you.